Hi, my name is Aryeh Cooperman. I'm the CEO of the PH Association in Israel, and I'm a caregiver of my wife. In Israel, most of the patients, nearly 100% of the patients, when they came the first time to a physician and they had the symptoms of PH, the physician told them that they are too nervous, that they have maybe problems with their husband, and they are too nervous maybe at work, and they just have to calm down and everything will be all right. And the problem is because the pH, you can't really see it only in an echo. And usually a young woman, nobody thinks that she has a problem in her heart. I always give an example of my wife and me. When she had the symptoms of pH, a few months she went to her physicians and nobody thought about the pH. Everybody told her just to calm down because they did the regular things and they saw that everything is all right. And when once I had like a little bit pains in my chest, it was the muscles, just the muscles outside of the heart. Immediately I was like in the hospital and they had echo and they checked me and they saw everything is all right, so they kicked me out. But my wife was like a few months and nobody thought about making an echo to her, just because she's a woman. And nobody thinks a young woman will have a problem in her heart. She was pregnant in her 5th month and she had these symptoms. She couldn't go from one room to the other room. And nobody, like I said, nobody thought that she has PH. And then one day I told my mother about it and she immediately, as a physician's wife, thought that's weird. And she told my father. My father is a cardiologist. So my father called me 11 o'clock at night and he told me, tomorrow morning you are in hospital. So my father says, we do it. So I sent her by herself, like we didn't even think that there's something serious going on. And I sent her to the hospital and after 2 hours I got a phone call, you better come. There's something serious going on around, and they told me she has PH and they had to stop the pregnancy in the 5th month because it's very dangerous to continue pregnancy with PH. I myself saw a few patients in Israel that wanted so much to have a baby and they got pregnant even though the physician didn't allow them. And a week after the birth, they died. So my wife stopped the pregnancy in the 5th month. And it was very, very difficult. And she was like 1 month in hospital. And took her 1 year just to be able to go out in the car, not by foot, just in the car, an hour to Jerusalem and backwards to Tel Aviv, without going out of the car because she was so sick. So it takes time to understand what's going on, and immediately you start to look out for physicians that really know all about PH. So we had to change the hospital because we understood the hospital we were in we didn't have experts in PH. So we went to Berlinson to Professor Kramer, who's a very known physician, and he took care of us, and we started a trial, and afterwards we took a subcutaneous remodeling, and that was very difficult for 1.5 years, and she was struggling, and we learned how to live our life differently and to understand that you can continue life, but in a slow motion. So after my wife was diagnosed, we went to there was a PH association already in Israel since 2000. My wife was diagnosed in 2005. So we went to this conference and they were asking for volunteers. I offered myself. And after a year that I was volunteering, they decided that I'm good to be a chairman. So they voted and they voted for being a chairman, and I was a chairman of the PH Association for a few years, volunteering. And after a few years, they decided that they want somebody to work for the PH Association, and that would be much better for the PH Association. So they decided to have somebody else to be the chairman, and I'm going to be the CEO. My role as a caregiver is to understand really what is to be a patient. Because to be a patient with PH, I see a lot of people that don't understand it. It's really very, very hard. It's struggling every second, every breath. The breath is something that we don't even think about. And they think about every breath they have, because every breath they have, it's difficult. Just bending or going to the other room, every little thing is very difficult for them. And going upstairs or just going up a hill, it's very, very difficult. So if you understand what they are going through, you can help them. Like I said, if it's too difficult for them to go to the other room, you understand that, and you quickly do things for them that they don't have to go to the other room. So the main thing is really to think about them and to understand what are they going through, and then you can really help them. Well, you struggle every day, you struggle every minute, and it's not easy not to be a couple and not to be a friend of somebody with a PH. So the main thing is to stop a few times in a day and to remember what they are going through, what they are struggling with, and to understand that a lot of what they say and what they behave, it's a lot of out of pain that they are struggling with. It's a pain and struggling with breath and struggling with not managing to do anything in life and not managing to have a normal life. And that they are struggling with years. It's year after year, it's day after day. It's not something that, like a sick person, usually we understand he is a sick person. He's not a sick person, because a sick person is sick for a few days and afterwards he has good days. They don't have a good day. They are struggling 24 hours, 7 days a week, 365 days a year. All the time, it doesn't stop that out of breath, out of breath, out of breath. And you can't even imagine a thing like that, like a person that all the time is out of breath. That's really can make you crazy. I don't know how she manages. So when you think about it, you appreciate it, and you behave differently. So our association in Israel is one of the biggest ones in the world that we have. All the treatments are available in Israel. We call it the basket of health. So the government pays for everything. And our association worked very hard to make sure that all the treatments are available for patients, and they're all in the basket of health. So patients have to pay about $100 a month. That's all for the treatments. So we can have double treatments. Triple is not available officially, but if somebody needs, they give it to him. A special thing that we have in Israel, we have a special project that we buy portable oxygen machines, concentrators for patients that need 24/7, they need oxygen. So that's very expensive to buy portable oxygen concentrators, about $3,000, even more. So we raise money for buying machines like that. We have already more than 35 machines, and we supply them to patients in Israel, not only for pulmonary hypertension patients, to all the pulmonary patients in Israel. And this really is a big project, and we will love everybody to help us continue to raise money, because all the time patients are calling me and asking for more and more portable oxygen concentrators. And like I said, we have 35, but that's not enough. My name is Aryeh Cooperman, and I'm aware that I'm rare.